Hey guys, it's spring break here, so I'm recording from my kitchen instead of my office. Hopefully this picture isn't too distracting for you. Today we're going to start talking about non-invasive positive pressure ventilation. At the very top of your PowerPoint, you'll see where it says NPPV. Remember, that's non-invasive positive pressure ventilation. That means that we're not intubating, we're non-invasive, we're not going into the body, we're going to use a mask. Positive pressure means we're pushing air into the lungs, and ventilation. We're blowing off CO2 and hopefully helping oxygenation as well. Underneath that, you'll see where it says CPAP and BiPAP. CPAP stands for continuous positive airway pressure, and you might remember that CPAP is the exact same thing as PEEP. PEEP is with an ET tube and a ventilator. CPAP is with a mask and a BiPAP machine. Continuous positive airway pressure. Then underneath that, you'll see BiPAP. That stands for bilevel positive airway pressure. That means there's an upper level and a lower level, hence bilevel. But we'll talk about that one a little bit later. Non-invasive positive pressure ventilation. What is it good for? Well, it's good for different disease types, but not all. And it does sometimes keep the patient from being on the vent longer than they need to be, or on the vent at all. So the first thing listed on here is what is it good for? We list CHF, that stands for congestive heart failure. Congestive heart failure is a very scary word. It makes you think that somebody's going to die pretty quickly. Congestive heart failure means left heart failure. That means the left side of the heart is not pumping like it should, which means that blood is going to back up into the lungs and the right side of the heart. Of course, the lungs are kind of right in the middle of the blood circulation through the heart. It goes through the right heart, through the lungs, and then the left heart. So if the left heart's not working, it backs up into the lungs. And you'll hear me say this quite a bit. The lungs are like a sponge right in the middle of the body. If there's any extra fluid, those lungs just soak it up. And you'll hear that with crackles, sometimes wheezes. And you'll see that on chest x-rays. I know we haven't talked about x-rays yet, but you'll see that on chest x-rays. They'll be really fluffy infiltrates is what they call it. What that means is that the vessels going from the right side of the heart to the lungs and then to the left side of the heart are really engorged. They're really full. And you can think of your vessels kind of like a water hose. So when your water hose gets a little too much pressure, too much volume, it may spring a leak. And that happens sometimes with congestive heart failure. And it's called pulmonary edema at that point. So when the vessels start leaking into the lungs, that big sponge in the middle of the body, we have to figure out how to push the water out of the lungs. How do we squeeze the water out of that sponge in the middle of the body? We can use CPAP. That CPAP literally just pushes pressure into the alveoli, opens them up, pushes the fluid out back into the vessels where it's supposed to be. CPAP works really, really good with CHF patients, especially if we use a drug called Lasix. Get used to hearing that drug, you're going to hear it. You'll probably hear it on a quiz since I just said that. So Lasix and CPAP work really, really well together with patients who have CHF or pulmonary edema. When CHF turns into pulmonary edema, that's when we need CPAP and Lasix. I hope that makes sense. If you have any questions, please let me know and we'll talk about it in class. The next thing on the slide is COPD. COPDers have really stretched out lungs. They have too much elastance, but they also have air trapping. So they've got these little bitty airways with these stretched out alveoli out here. All this air just keeps getting trapped and trapped and can't get out. So what CPAP does is it opens up those airways so that the air can get out. It helps with the air trapping. This works really well with exacerbation of COPD. Exacerbation means they're having a problem right now. COPDers always have COPD. May, June, July, January, December, it doesn't matter. They have COPD. But in the summer months, they will have more exacerbations, more problems. They'll be in the hospital more. So exacerbation just means a problem with your COPD disease. And they have more air trapping. And then they get really panicked because they can't breathe. If you couldn't breathe, you'd get scared too. By using the BiPAP, they're still able to talk, eat, that kind of thing, because we can remove the mask when we need to. And it opens up the airways. It helps them breathe better. Same thing with asthmatics, works the exact same way. And I have listed underneath there Heliox. Heliox is an amazing, cheap invert gas that I wish every single hospital would use because they should use it, sorry. And it opens up the airways. It's lighter than air. Its density is lighter than air, so it can get through all that air trapping. and patients can just breathe so much easier. I've seen it work so many times with asthmatics and COPDers, and their work of breathing goes down. They're not as anxious. It gives time for all those steroids to kick in. It's just really a good thing to have on board. If you are ever in charge of a department, please make sure you have Heliox. And then underneath that, it helps people get extubated faster, especially those COPDers again. Sometimes we want patients off the vent sooner than what they're really ready for. Because again, the longer they're intubated, there's more risk of infection, barotrauma, volume trauma, increased ICP, and all of those. So the sooner we can get them off the vent, the better off they are. Sometimes we just can't do it as fast as we'd like. So we can use a non-invasive route. That means that we can take the tube out, get that ventilator out of the room, but then put them on a mask and help them wean off of the ventilator, so to speak. And then the last thing I have listed here on this slide is OSA. That stands for obstructive sleep apnea. You've probably seen this, maybe your relative's home or something like that. They have sleep apnea and they have a CPAP machine that they use at home. Again, it just splints open the upper airway because whenever we sleep, all of these muscles relax, the tonsils relax, and when people are snoring, what's happening is the airway is actually getting occluded. And sometimes that snoring can lead to apnea. I've seen people not breathe for almost a minute because of those obstructions. That's pretty scary. So we use CPAP to open up these upper airways up here, and then they can sleep better. Decreases the risk of stroke and heart attack. It's a really good thing. Okay, so just to review, CPAP, continuous positive airway pressure. It is the exact same thing as PEEP, but in a non-invasive way. So if you've got somebody on CPAP, that means they have a mask on. That means it's non-invasive. Or they could have something called nasal prongs, non-invasive. Continuous positive airway pressure. What that means is the pressure is continuously in the lungs and it's holding the pressure open at all times. If you have a CPAP set at 10, that means there's 10 centimeters of water pressure in the lungs at all time. It fixes refractory hypoxemia. If you don't remember what that means, refractory hypoxemia means hypoxemia that does not respond to oxygen. So if you've got a patient whose PaO2 is 50 and you put them on an armored breather and you go back a couple hours later and their PaO2 is only maybe 55, you've increased their FiO2 from 0.21 to 1, and yet their PaO2 only increased by 5. That's not fixing it. That is refractory hypoxemia. Oxygen did not fix the problem. So we call that refractory hypoxemia. That means they're shunting and they need PEEP. And if that's all they need, we may not need to intubate them. We can just use non-invasive means with a CPAP. Okay? And then we talked about obstructive sleep apnea, those patients who have apnea periods when they sleep. And then we talked about COPD, helping those patients with air hunger whenever they're having exacerbations and they're getting more air trapping than usual. Goes on with asthmatics. And remember we said Heliox was a really good tool to use with those patients. And then again, CHF, congestive heart failure. When fluid and blood, extra fluid, fills up the left heart, backs up into the lungs soak it up like a big sponge, and we got to figure out how to push that fluid out of the lungs. We use CPAP. And again, it works really good with that drug called Lasix.